Very good. Any questions? We'll move on. Under old business, second reading of 19. I'm sorry, I'm sorry, Mr. Butler. I missed you. 80. Mr. Butler, I had it written down and just didn't look at it.
I'm going to try and be as brief as possible. I'm here to ask about a grant. But first, I'd like to give you a couple of little bits of data. One out of every 3 cancer deaths in the U.S. can be linked to tobacco. Of every death, there's 30 people that are going to become disabled or ill due to tobacco. North Carolina ranks 29th in cigarette smoking and 36th in smokeless tobacco use, number 1 being the best. North Carolina direct medical costs due to tobacco-related illness among smokers exceeds $3.8 billion a year. That's just North Carolina. And secondhand smoke exposure accounts for an additional $293 million a year in North Carolina. What I'm here this evening to ask for support. We have been asked by the North Carolina Department of Health and Human Services Division of Public Health Tobacco Control Branch to facilitate and be a partner on a regional tobacco initiative. This is a grant through the CDC. The grant has been around for a very long time, and because of our successes with our community transformation grant, and now we call it the 1422 grant. It's a chronic disease management grant that we've got that's a regional grant. They've asked if we would take on, as a county, to be the lead in this regional project and take that grant on. It's a $75,000 a year grant. The cycle runs every 5 years. This year is the beginning of a new cycle. We are, let me skip along here, trying to get fast. What we are being asked to focus on is to reduce exposure to secondhand smoke, decrease tobacco among adults, use among adults and youth, and to decrease initiation of tobacco use among youth and children and young adults. In 2013, the Youth Risk Behavior Survey that's done here in North Carolina showed a decline in the number of students in middle and high school in that cigarette smoking rates. However, it showed an increase, a significant increase in the use of other tobacco products among teens, including emerging tobacco products like e-cigarettes. What this would require us to do is, 1, accept the grant as a county. 2, we would have to form a regional leadership team, which we already have through the Mountain Wise project, which was the CTG grant, which is Mountain Wise Incorporated, which is the 8 health directors in the region. And our region consists of Transylvania, Haywood, Jackson, Macon, Cherokee, Graham, Swain, and Clay. We would also have to hire a regional tobacco program manager and form a regional tobacco-free collaborative, which would include key representatives of the county government and local health folks like hospitals and physician practices and school systems. So what I'm asking is, can we be the fiduciary and the lead agency for this $75,000 grant? There is no county money, no county match required for us to take these funds. And we will work with the 8 health directors, or the other 7 health directors in the region, including myself, on it, as we did the CTG.
Mr. Mayor, can you review this?
Yes.
Your recommendation.
To move forward, as Mr. Rudner alluded to, the health department matter of fact received national recognition for their previous work in working toward tobacco cessation. So I think we've got a very competent staff and they're very capable of running this project.
And then, if I have 1 second to make another comment, this has not gone to the Board of Health. This all happened in the past week. So Commissioner Hayden doesn't know. Ms. Murray back here, the Board of Health member, doesn't know that we're heading this direction. We are going to take that to them after this, but as part of the budget process, we need to get it done and get it in. And basically, I need to go back and beg forgiveness to the board because I had to come here first.
What's the timeline on the grant?
It begins July 1 with the new budget year. So we got to get it in as part of the budget if we're going to do it.
We don't have any June expenditures.
No, we should. Well,
talk about like our June state budgets.
We have. The key is going to be hiring a person, so I don't think we'll have anyone before July 1st. No.
Just want to make sure.
I'm trying not to do that to us.
Questions for clarification that Holly are bringing that.
The source of funds, I know, on the transformation program is part of the Affordable Care Act. This is CDC grant, but
The affordable,
relief
yeah.
or golden leafers.
No, I wish. They used to have about $17 million in the state that was distributed a portion to counties, and we had tobacco people in every county. We have one here in Macon County. And when they decided to use that money for whatever the legislature decided to use it for, we lost it. The Community Transformation Grant was Affordable Care Act dollars, Prevention Public Health dollars, and our federal legislators decided that because the Affordable Care Act was going to take care of everybody, that they would cut that money because we didn't need prevention dollars anymore. So that money went away. So we only had that grant for 2.5 years. This is different. This is tobacco grant that's through the CDC. It's been in place for many years. The individual, I think, that in the region that's in that position is retiring. That's how long that money's been around. They've just asked us, because of our track record over the past 2.5 years of Community Transformation Grant, to be the fiduciary agent.
Is the settlement money safe?
No, it is not attached tobacco settlement money. It's direct federal prevention dollars. It's not the prevention public health dollars, tobacco prevention dollars at the federal level. And it goes directly to CDC, goes to the tobacco branch here, and then is distributed to us. There are going to be 10 of these grants in the state. We're not the only one. Or, excuse me, 9 of these grants in the state. We're not the only one.
Motion to approve.
Motion second by Shields. Any discussion? Hearing none, I'll say aye. Aye. Opposed? Motion passed. Thank you very much. The